Good evening, guys. I've got discussion C for you. We're discussing tonight for C. We're discussing the prolonged use and long-term side effects of prednisone. So please join me for the presentation I made. Maybe eye-opening for some people, but that's why I decided to do this one. So it will be people's FYI if they're having side effects and everything. So let's get into it, shall we? The page from helpdementia.com offers a clear, medically grounded overview of the long-term side effects of prednisone, a corticosteroid commonly prescribed for inflammation and autoimmune conditions. While effective in the short term, extended use can lead to serious health complications across multiple systems. Here's a breakdown based on the page content. Okay, first one, guys. It causes bone problems. In particular, long-term use of prednisone causes osteoporosis. Is one of the most significant risks. Prednisone weakens bones, increasing fracture risks, especially concerning for older adults or those with pre-existing bone issues. Hormonal disruption. Next one. Adrenal insufficiency can occur when the body stops producing cortisol due to reliance on prednisone. This can cause fatigue, muscle weakness, and mood swings, especially if the drug is stopped abruptly. Growth and development. In children, long-term use may slow growth, potentially leading to lasting developmental effects. Next thing, metabolic effects. High blood sugar is common, posing risks for people with diabetes or those prednisone or predisposed to it. Careful monitoring is essential. Immune system suppression. Prednisone lowers immune defenses, making infections more frequent and harder to treat. Other side effects: weight gain, high blood pressure, and gastrointestinal issues like bloating and heartburn can also emerge over time. Clinical guidance. This page emphasizes that while these risks are serious, they can often be managed with close medical supervision, tapering off the drug gradually rather than stopping suddenly. It's crucial to avoid adrenal complications. If you're working on a toolkit or resources around medication literacy or aging related pharmacological, this could be a strong candidate for myth busting or decision support materials. Want to co-design something around safe tapering protocols or caregiver guidance. When tapering off prednisone, it's crucial to watch for signs of adrenal insufficiency and withdrawal, especially if you've been on it for more than a few weeks. These symptoms signal that your body may not be producing enough cortisol yet to compensate for the reduced dose. Key symptoms to monitor during tapering: neurological and mood changes, fatigue or overwhelming tiredness, mood swings, irritability, or depression. Okay. Anxiety, delirium, or even mania in rare cases. Musculoskeletal pain, joint stiffness or pain, muscle aches or tenderness, systematic signs, low blood pressure or feeling lightheaded, fever or general malaise, headaches, and labored breathing, gastro and appetite, nausea, vomiting, or loss of appetite, weight loss without trying, skin and hormone clues, darkening of the skin, rare but noticeable, weakness and sense of being unwell. What to do if you notice these? Don't adjust your dose on your own. Contact your health provider immediately. You may need a slower taper or temporarily return to a higher dose. Blood tests for cortisol levels can help guide safe tapering. If you're building a toolkit or a resource around medication literacy or caregiver support, we could design a symptom tracker or culturally adaptive alert system. Want to sketch out what that could look like? If you notice symptoms of adrenal insufficiency or prednisone withdrawal, like extreme fatigue, dizziness, joint pain, mood changes, or nausea, It's important to act promptly and carefully. Here's a step by step guide to help you respond safely and effectively. Immediate actions. Pause the taper. Don't stop completely. Do not do not discontinue prednisone abruptly. If symptoms are severe, your provider may recommend temporarily increasing the dose before resuming a slower taper. Contact your health provider. Reach out immediately to discuss your symptoms. They may order blood tests, cortisol levels, or a ACTH simulation stimulation test to assess adrenal function. Track your symptoms. Keep a daily log or physical, emotional, and cognitive changes. Note timing, severity, and any tiny triggers. This helps guide clinical decisions. Supportive care. Stay hydrated and rest. Avoid stressors that could further tax your adrenal system. Gentle movement like walking or stretching may help with stiffness and fatigue. Clinical follow up. Your provider may adjust your tapering schedule, e.g., reduce dose more slowly or switch to alternate day dosing, prescribe hydrocortisone or other corticosteroids temporarily if adrenal suppression is sufficient, significant, I mean, refer you to an endocrinologist for specialized care. Optional toolkit ideas. If you're building a caregiver or community resource, we could co create a symptom tracker template tailored for aging populations. A decision making support flow chart for tapering response, myth busting guide on steroid withdrawal and adrenal health. Want to sketch one out together? When contacting your healthcare provider about symptoms during a prednisone taper, clearly and specifically are key. You want to help them quickly assess whether you're experiencing adrenal insufficiency, withdrawal, or flare up of your underlying condition. Here's a sample script you can adapt. What to say to your provider. Hi, I'm currently tapering off prednisone under your guidance. I've started experiencing list symptoms. e.g., fatigue, dizziness, joint pain, mood changes, nausea. These symptoms begin insert when they've been they they've been getting worse, saying the same, improving slightly. I'm concerned they may be related to adrenal insufficiency or withdrawal. Should I adjust my tapering schedule or come in for evaluation? I'm happy to track symptoms or get labs if needed. Okay, that's what you say to your doctor if you're having issues. All right, so helpful details to include current prednisone dose and taper schedule, duration of prednisone use, any recent changes in dose, other medications, or health concerns. Symptom log. If you're building a caregiver toolkit or community resource, we could co-create a culturally responsive communication template, something that empowers patients and caregivers to advocate clearly and confidently. Want to sketch that out together? Absolutely. Here are tailored sample scripts for different prednisone related scenarios, each designed to help patients or caregivers communicate clearly and confidently with healthcare providers. These can be adapted for use in currently and culturally responsive toolkits or caregiver guides. Okay, guys. So scenario 1 is the following. Give me a minute and I'll read it to you. Hi, my name is blank. I've been tapering off prednisone and I've started experiencing, e.g., fatigue, dizziness, joint pain. These symptoms began, insert timing, and seem to be worsening or slash stable, improving. I'm concerned about adrenal insufficiency or withdrawal. Should I adjust my taper or come in for labs? Scenario 2, requesting a slower taper. I'm currently tapering from prednisone at current dose, but I'm noticing, e.g., mood swings or mood changes, joint pain, fatigue. I'd like to explore a slower tapering schedule or alternate day dosing. Could we discuss options that might reduce withdrawal symptoms? Guys, these are things that you can ask your doctor to help you with if you're experiencing symptoms from prednisone use. Okay? Scenario 3, asking for cortisol testing. Given my symptoms during the taper, especially, e.g., extreme fatigue, nausea, low blood pressure, I'd like to check if my adrenal function is suppressed. Would you be would it be appropriate to order a cortisol or ACTH stimulation test? Okay, scenario 4, mental health concerns. Since starting prednisone, I've noticed significant mood swings and anxiety. I understand this can be a side effect. Could we discuss strategies to mitigate these symptoms or adjust my dose? Okay, that was scenario 4. We're at scenario 5. And this is a pediatric or caregiver advocacy. Okay, my child has been on prednisone for duration. I'm concerned about slowed growth and immune suppression. Could we review the long-term risks and tapering plan together? I'd also appreciate guidance on monitoring for infections. Now, guys, because people use prednisone for long term, sometimes they're prone to infections easier because your immune system is suppressed from the pills. Okay, scenario 6, planning to discontinue prednisone. I'm feeling stable and would like to explore discontinuing prednisone. I understand tapering is essential. Could we create a personalized tapering schedule and discuss what symptoms to watch for? Would you like to co-create a printable communication guide or decision support tool around these? We could even adapt it for neuro clinics or multilingual caregiver settings. Okay, guys. So that is C for you. I'll be back on shortly with the other half of this presentation, which would be discussion D. I'll be back on shortly with that for you. For now, Gator Wellness, take care, folks.